Hello, today you're about to learn compressions-only CPR, recognize and act. Studies have shown the most effective tool that increases survival in patients suffering from cardiac arrest is chest compressions. Cardiac arrest is when a person's heart stops beating and they stop breathing. We must be able to identify that a person is in need of chest compressions before we act. Chest compressions keep a person's blood circulating throughout their body. If you witness a person collapse, do something, take action, be 911. This is Alan. Hello. He could be you, a bystander who will help me show you the steps you will need to take in order to initiate compressions-only CPR. CPR saves lives. I learned it, and now you will too. First, check to see if the person is responsive. Do this by tapping the person on both shoulders and shouting continuously like this. Sir, are you okay? Can you hear me? We want to make sure the person is not sleeping. If the person does not respond or wake up, we know this person needs help. Next, immediately send someone to call 911. Point to someone and make sure the person you shout to knows you want them to call 911. If possible, have someone attempt to locate an automated external defibrillator. You, call 911 and get an AED. If no one is around, call 911 yourself. Now, if the person is not breathing or appears only to be gasping, you need to begin chest compressions. Do this by finding the center of the person's chest. The optimal location for chest compressions is in the center of the chest, directly over the sternum. Use the heel of your dominant hand, place the other hand on top like this, and interlock your fingers like this, and begin compressing the chest. Push hard and push fast. Keep your elbows locked, keep your back straight, and bend at the hips. You need to perform at least 100 compressions per minute. Remember, the key is to push hard and push fast. Great job, Alan. That's exactly how it's done. Now we will discuss some of the guidelines that should be followed in order to perform the best chest compressions. Compression should be performed on the center of the chest, pressing down hard and fast, approximately 2 inches deep for adults, which is about halfway down on the chest. The victim must be on the floor when you do this. You may feel cracking under the person's skin due to ribs being broken. This is a common occurrence and should not deter you from continuing compressions. Broken ribs heal, but stopping compressions can ensure death. The chest should be allowed to fully recoil or allowed to return to its normal shape between each compression. Keep pressing on the chest and attempt to maintain a rate of at least 100 per minute. The lyrics to the song, Let's Get It Started, and many other songs follow a tempo of 100 beats per minute. Keep pressing on the chest until another person that is trained in CPR takes over or there are signs of life.